Our top focus in this edition, the spread of the JN.1 subvariant of COVID-19 is causing concern in the UK and confirming the presence of the variant in Britain. The UK Health Secretary has expressed concern over the alarming rise in the cases. Reports suggesting that as compared to other strains, the subvariant JN.1 has a 70% higher potential when it comes to transmissibility. Its impact on children has been particularly worrying. Health experts are also warning of a resurgence in COVID-19 flu and seasonal bugs. Meanwhile, the surge in cases coming as a result of January's freezing temperatures and the post-festive gatherings as well, and the return to offices and classrooms post the holiday season also contributed to the skyrocketing infection rates. This Juno variant, or JN.1, a spin-off of the Omicron strain, is now responsible for 2/3 of the new cases. Juno accounts for 64.5% of the UK's COVID-19 cases, officials urging the individuals with symptoms to limit contact with the vulnerable groups and sections of the population. In fact, this JN.1 subvariant has also been causing concern. The UK Health Security Agency has said that the last 7 days saw a rise of 598 new hospitalization cases, resulting in 3,800 active cases this week, and 13 deaths were also reported in the same period. However, positive COVID-19 cases marked a drop of 813 cases from the previous week, which is almost 10% lower than the last week of December. Earlier, the World Health Organization advised all the healthcare facilities to follow masking regulations. It also recommended the additional use of respirators and other personal protective gear for medical professionals. Many Britons are also questioning the Rishi Sunak government's handling of the present COVID-19 crisis and lamenting how even in the past, during lockdowns, the UK government was found waiting. They have urged the Tories to take the virus seriously. And for more on this, we have with us our correspondent Stuart Smith joining us from London. Stuart, tell us more about the situation on the ground and to what extent this variant is causing concern and the kind of measures that are being taken by the authorities.
There are 4 viruses that the UK Health Security Agency are carefully monitoring right now. That's the rhinovirus, RSV, COVID, of course, and particularly that JN1 subvariant, and influenza. And if you take a look at the graphs as of today, you may actually be slightly reassured. It looks like for 3 of those, COVID, RSV and rhinovirus, the rates are going down. It's influenza that is really spiking up, by 44% over the past week. That's the one that medical professionals are particularly concerned about as things stand. But then this is the next step. The epidemiologists are warning, with people going back to work this week, with people going back to school this week, there is a concern that COVID will start to rise again. And so in terms of what is being done about this, the UK government and the health service in England has not mandated, for example, that nurses and doctors should wear masks in a clinical setting, something the Nurses Union has written to the National Health Service about, saying that that is the World Health Organization advice and should be implemented. Similarly, there's no talk of new restrictions being introduced, but there is a concern with COVID and this subvariant JN1, not because it's by any means particularly more deadly or increasing compared to previous subvariants the rate of hospitalization, but because it's spreading more easily and particularly amongst young people. And as they go back to school, we could see an increase over the next few weeks. In terms of the background situation here in the UK, epidemiologists point to a number of problems making infections in general worse. They note that, for example, you can get COVID, influenza and rhinovirus all at the same time, making the chance of hospitalization even greater. They say there's also an ongoing issue with obesity in the United Kingdom, which does increase the severity of any virus infection. And also the UK has been dealing with strikes amongst junior doctors over the past week, something that is severely hitting NHS capacity, National Health Service capacity, making it even harder for doctors who are having to treat patients that do make it to hospital and get them well again.
Right. Stuart, what are you picking up from the authorities and from the officials you've been speaking to about the reasons as to why we are seeing this situation unfolding on the ground when it comes to the January freezing temperatures, also the post-holiday season, or is there more to it?
Yeah, so actually, interestingly, the experts say that during the holiday period, infection rates tend to go down. It's then when people come back to schools, to work, and to their homes, that's when the infections pick up again. And that's why they're pointing out not to be overconfident by the fact that in the past 2 weeks, COVID peaked 2 weeks ago. It now seems like the figures are going down. That's why they're saying, oh, be careful, because this could be on the verge of increasing again. But what they're not doing is saying people need to take any significant measures, and people disagree, experts disagree about whether that should be the case. We know that in Asia, masking has, throughout the pandemic, it decreased the number of hospitalizations on general, and there is no particular advice in the UK being issued to wear masks more frequently, for example, even though epidemiologists know that is something that would help. And that extends to the healthcare setting, where nurses and doctors can, if they feel it's appropriate, mask, but on the whole, choose not to, because there is no requirement to do so. And so there is more that could be done, epidemiologists say, to try and make any future wave of COVID less severe. The problem is, though, the government so far is not asking for that to happen.
Right, we're leaving it there for the moment, Stuart. Thanks very much for joining us on the broadcast. WION now available in your country. Download the app now. Get all the updates on the move.